Hello there, let's have a chat about something we all do but rarely discuss: poo. It might seem a bit of a funny topic, but the color of your stool can actually tell you a great deal about what's happening inside your body. Think of it as a little message from your gut, giving you clues about your overall health. Normally, your poo gets its characteristic brown color from a substance called bile, which is produced by your liver and helps to digest fats. When the color changes, especially if it becomes pale white or clay-colored, it's a sign that something might be amiss in your digestive system. It's a signal you shouldn't ignore. Paying attention to your bowel movements is a simple yet effective way to stay on top of your health. It's not about being obsessed, but rather about being aware. Just a quick glance in the loo can give you valuable information. A change in color consistency or frequency could be the first indication that your body needs a bit of extra care or perhaps a checkup with a doctor. Understanding what is normal for you is the first step. That way, when something changes, you will notice it straight away and can take the right action to look after yourself, which is brilliant. So, what exactly does it mean when your poo turns pale? Generally, it suggests there isn't enough bile reaching your stool. Bile is a greenish-yellow digestive fluid that is crucial for breaking down the fats from the food we eat. As it travels through your intestines, chemical changes turn it brown, giving your poo its typical color. If your stool is pale, it often points to a problem with how bile is being produced in the liver, stored in the gallbladder, or released into the small intestine. It's a clear signal that a key part of your digestive process isn't working as it should be. Don't panic just yet, though. While it can be a sign of a health issue, an occasional pale stool might not be a cause for major concern. Sometimes what you've eaten can temporarily affect the color. However, if you consistently notice that your poo is pale, it's definitely something to investigate further. It's all about being proactive and listening to what your body is trying to tell you. By understanding these signals, you're taking a positive and responsible step towards managing your well-being, and that's always a fantastic thing to do for yourself. So, what could be causing your poo to lose its color? One of the most common reasons is a blockage in your bile ducts. These are the small tubes that carry bile from your liver and gallbladder to your small intestine. If these ducts get blocked, perhaps by a gallstone, a cyst, or inflammation, what the bile simply can't get through. It's a bit like a traffic jam on a motorway. Everything backs up. The bile can't mix with your food to aid digestion and give your stool its normal brown shade, resulting in a pale or clay-like appearance. It's a mechanical problem that needs looking at. Another major area to consider is your liver. The liver is a powerhouse organ, and one of its many jobs is producing bile. If your liver is inflamed or damaged, a condition known as hepatitis, or if you have a more chronic liver disease like cirrhosis, it might not be able to produce enough bile. This can happen due to viral infections, excessive alcohol consumption, or other underlying health conditions. When bile production drops, it naturally leads to less of it ending up in your stool, which is why the color can change so dramatically. Your liver is incredibly important, so any signs it's struggling need attention. Your pancreas could also be involved. This organ sits just behind your stomach and plays a vital role in digestion. Problems with the pancreas, such as pancreatitis or even pancreatic cancer, can sometimes block the bile duct. Because the bile duct passes through the head of the pancreas on its way to the small intestine, any swelling or growth in that area can squeeze the duct shut. This, again, prevents bile from reaching your gut and results in pale stools. It highlights how interconnected all the organs in your digestive system truly are. Finally, it's worth remembering that certain things you ingest can also be the culprit. Some medications, particularly those used to treat diarrhea or indigestion that contain substances like bismuth subsalicylate, can lighten your stool color. In a similar way, eating a large amount of very fatty or pale-colored foods might lead to a one-off pale poo. Even a barium enema, a medical test that uses a chalky liquid to examine your colon, will cause white or pale stools for a few days afterwards. So, it's not always a serious disease, but it's important to know the difference. While a single instance of pale poo might not be alarming, it's crucial to know when it becomes a more serious warning sign. The key is to look for other symptoms that accompany the change in stool color. If you notice pale stools along with yellowing of your skin or the whites of your eyes, a condition called jaundice, you should see a doctor straight away. Jaundice is a classic sign that bile isn't being processed correctly by your liver, causing a buildup of a substance called bilirubin in your blood. This combination of symptoms points strongly towards a problem with your liver or bile ducts. Pain is another significant red flag. If your pale stools are accompanied by persistent pain in the upper right side of your abdomen, it could indicate a gallstone that is blocking a bile duct. This pain can be severe and may come on suddenly, especially after eating a fatty meal. Other worrying symptoms to watch out for include unexplained weight loss, feeling constantly sick, and vomiting, a very dark urine color, or extreme tiredness. When these symptoms appear together with pale stools, it's your body's way of shouting for help, and it's a call you must answer promptly. So, what does an unhealthy stool look like compared to a healthy one? A healthy poo is typically sausage-shaped, smooth, or with a few cracks, and easy to pass. It should be a shade of brown. Unhealthy stools, on the other hand, can vary widely. Pale, white, or clay-colored stools are a concern, as are black or tarry stools, which could signal bleeding in the upper gut. Bright red stools might mean bleeding lower down. Stools that are consistently watery or hard and lumpy are also signs that your digestive system is not at its best. Knowing when to seek medical advice is key. If you notice pale stools for more than a couple of days, or if it happens on and off, it's always best to get it checked out. And if you have any of the red flag symptoms we've discussed, like jaundice, abdominal pain, dark urine, or unexplained weight loss, you should make an appointment with your GP without delay. Don't feel embarrassed to talk about it. Your doctor deals with these issues every single day. Getting a proper diagnosis is the first step towards getting the right treatment and feeling better. The good news is that there are many simple, practical things you can do every day to help keep your digestive system happy and healthy. The foundation of good gut health is a balanced diet. This means eating plenty of fiber from sources like fruits and vegetables and whole grains. Fiber helps to keep your bowel movements regular and feeds the good bacteria in your gut. Try to include a rainbow of different foods in your meals to ensure you're getting a wide range of nutrients. A healthy diet is one of the kindest things you can do for your tummy. Staying hydrated is also incredibly important. Drinking plenty of water throughout the day helps to soften your stool, making it easier to pass and preventing constipation. It also supports the overall function of your digestive organs. Alongside this, it's wise to limit your intake of things that can irritate your gut. This includes excessive alcohol, which can be very damaging to the liver, and fatty, processed foods, which can put a strain on your gallbladder and pancreas. Making mindful choices about what you drink and eat can make a huge difference to your long-term digestive health. Don't forget the importance of an active lifestyle. Regular physical activity, even something as simple as a brisk daily walk, can help to stimulate your intestines and promote regular bowel movements. Exercise is fantastic for your overall well-being, reducing stress, and helping you maintain a healthy weight, both of which have a positive impact on your digestive system. Quitting smoking is another brilliant step to take, as smoking is linked to numerous digestive problems, including an increased risk of liver and pancreatic issues. It's all connected, you see. Finally, remember that noticing a change in your body, like a different stool color, isn't something to be scared of. And it's a sign that you are in tune with your body. And that is a very positive thing. While not every change signals a serious problem, it's always sensible to be cautious. If you have any doubts or if a change persists, please don't hesitate to speak with a healthcare professional. Taking charge of your digestive health is a journey, and seeking help when you need it is a crucial part of looking after yourself properly. Stay well.